and today I will be talking about behavior drugs and children with ADHD. According to the Healthline Network, 6.4 million American children ages 4 through 17 have been diagnosed with ADHD. To define what this affliction is, ADHD stands for Attention Deficit Hyperactivity Disorder, where children with this condition have intense sustained difficulty paying attention and to controlling their behaviors. This presents a challenge to parents and teachers trying to maintain a environment of discipline within schools or within homes because of their hyperactivity. Parents and teachers may find dealing with ADHD in children cumbersome and look to medication as the perfect, easy solution. The most common prescribed treatment for ADHD is Ritalin methylphenidate. According to the FDA in 2000, 1 out of 8 children were on Ritalin in the United States, and this brings me to my central focus of this speech, that behavior drugs such as Ritalin are too dangerous to be used in the treatment of ADHD in children. 3 reasons are going to support this claim, and they are Ritalin and drugs constitute health risks, it promotes drug abuse in the community, and there are safer alternatives to Ritalin. First, Ritalin and drugs constitute health risks. The temporary relief of Ritalin is not worth the risks of giving drugs to children. Ritalin can lead to brain damage. According to the National Institution of Health, Dr. Carlazon and Dr. Anderson examined the effects of exposing rats to Ritalin during early development. The same doses were given to children prescribed. Examining the behavior during adulthood, they conducted several types of tests that showed that the animals had a reduced ability to experience pleasure and reward. In addition, they found that the animals exposed to Ritalin during pre-adolescence were more prone to express despair-like behaviors in stressful situations. Overall, the animals showed more evidence of dysfunctional brain reward system and a depressive-like behavior in adulthood. These findings are critical because Ritalin can have long-term consequences in functioning brains. My next point is that Ritalin has adverse side effects. Ritalin increases dopamine in the brain, but unnecessary increase in dopamine in childhood may change how the brain is developed. The American Psychiatric Association states that suicide is a major complication of withdrawal from Ritalin. And other side effects are stated by the FDA. The Food and Drug Administration identified possible safety concerns that had psychiatric adverse effects when treated with ADHD of Ritalin, such as visual hallucinations, suicidal ideation, psychotic behavior, aggression, and violent behavior. In addition, the current FDA medication guide warns of heart-related problems with Ritalin, including sudden heart attacks in patients who have heart problems, stroke and heart attack, and increased blood pressure and heart rate. Also in teens and children, new psychotic symptoms such as hearing voices, believing things that are not true, and suspicious things, and new manic symptoms. My next point is that Ritalin is similar to cocaine and stronger than cocaine. According to the Center of Disease Control and Prevention, Ritalin and cocaine also look and act very much alike because they have a similar chemical structure. They both increase dopamine levels in the brain. A study in the American Journal of Medical Association concluded that this methylphenidate is chemically similar to cocaine. We see these effects in people's lives, such as Mandy Smith of Banff in Scotland, who had a son of 8 children, who was prescribed to Ritalin for 9 months, and she states that, "I am astonished the British government has allowed this drug to be prescribed. It can destroy people's lives. My son was a changed person when he took Ritalin. He was suicidal and depressed." The USDA, the U.S. Drug Enforcement Administration, classifies Ritalin in the same category as morphine, cocaine, and opium. My next contention is that Ritalin promotes drug abuse in the community. Resorting to behavior-modifying drugs could cause children to have a drug dependency that can lead to drug abuse in later life. Ritalin leads to addiction, which is also stated by the DEA. ADHD children are typically taken off Ritalin when they reach adulthood, and these individuals seem more prone to cocaine addiction. Because Ritalin and cocaine are similar drugs, they are self-treating themselves and using it as a cocaine replacement. And that is from the Genetic Science Learning Center. The youth are abusing the easy accessibility of Ritalin. Partnership for a Drug-Free America released the findings of the survey and determined that 10%, 2.3 million teens, had abused Ritalin and Adderall. Another supporting statement is from the National Center on Addiction and Substance Abuse of Columbia University, issued a report stating that 15 million Americans were getting high off of prescription drugs, Ritalin, such as Ritalin. These drugs were abused. They were abusing these drugs more than cocaine, heroin, and methamphetamines combined. And in the long run, teens who abuse these prescription drugs were 12 times more likely to use heroin, 14 times more likely to use ecstasy, and 21 times more likely to use cocaine. It is no secret that the youth is being affected by these drugs. The DEA reports on its website that the increased use of this substance in the treatment of ADHD has paralleled its increase in its abuse amongst adolescents and young adults who crush these tablets and snort them to get high. Youngsters have little difficulty obtaining these from classmates or friends who are prescribed. Children with these prescriptions are risking their own lives as well as the lives of other kids. Finally, there are safer alternatives to Ritalin, such as behavior therapy, which is recommended. According to Prevention Magazine, the #1 consumer health magazine in the country, ADHD researcher George DuPaul, PhD and psychologist, reveals that ADHD treatment is creating an ADHD-friendly environment. The key is identifying preschoolers who may be at risk and teaching their children and teaching their parents, and teachers new skills such as to control discipline and anger, impulse control, and to promote social awareness. This helps the child reduce hyperactivity and gain a better focus. Behavioral therapy, which is now the recommended first-line treatment, is stated by the CDC as well. The increasing rates of behavioral therapy would increase the alignment of current practice and existing medical guidelines for ADHD and could improve quality care for children with this infliction. Healthcare providers should be aware that psychological resources in the community so that they are prepared to refer their children for behavioral therapy as recommended by the American Academy of Pediatrics. Lastly, my third and last contention is that individualized education plans, IEP, are available to students with learning disabilities. IEPs are specific education plans for students with disabilities created with input from teachers, parents, and even students themselves. They are detailed and designed to meet the unique needs of the child. According to Child Trends Org Childtrendorg's data bank, early, accurately targeted interventions help each student learn to the best of their ability, improve their quality of education, and avoid future problems such as grade retention or academic failure. In conclusion, Ritalin is dangerous to be used with ADHD due to its health risks and adverse effects in comparison to safer and more recommended options. Though it is more common these days to treat emotional problems with a bottle of pills, this is a mistaken belief in that solving ADHD with drugs is like solving poor eyesight with contacts. The easy solution is not always the best solution. Thank you.
Right. Propositions clearly identified, contents are previewed. I think that there's some controversy based on the number of people who are using the drug. I think that establishes that there is going to be a dispute on those particular points. I think you're in good shape there. Signposting on the secondary points internally is fine. Delivery's a little bit mechanical. I think there needs to be more variation in the presentation. You're also rushing a bit. I can see why you're rushing because your speech is 8 minutes, so you're basically a third of the time over when you finish. So that's a little bit problematic. You're going to have to try and keep your arguments a little bit more focused. There's excellent citation of evidence in the presentation for the most part. Once in a while, I think we're missing the comparative data that would allow us to reach these conclusions about the relative safety. That some of these problems exist. I'm not sure that there's much dispute about that, but how big the risk is on those particular things, that I think there is some question about. And probably the biggest issue that the response speaker is going to be dealing with is whatever benefits there are. If you've got 10 million kids who have these particular problems and this drug changes their lives positively for 9 million of them, and we've got 1 million of them who are harmed, maybe there's a trade-off here that we should look at and see if that's an acceptable risk. I don't know how we make those kinds of comparisons, except that doctors and the parents and the teachers have to make those decisions. And there's not really any discussion about this. There seems to be a presupposition that this is the default way of treating ADHD issues. And I didn't really hear much argument about that, so I think that needs to be documented a little bit more. You're the only person I've ever heard pronounce it the way you did, so that's a little bit awkward, and
No, I Googled it. So you can you can search it up.
well, like I said, I've never heard it referred to with a Y sound instead of the short I sound, So it was awkward when I was listening to it. I didn't fail you based on that. I'm just telling you, I've never heard it referred to that way,